Hello, my name is Azra Khatun. I am a CT2 in general surgery, currently working at Portsmouth Hospitals University Trust. I am British Bangladeshi by background, and I'm also the founder and director of the Surgical Scarf Project, which is a national campaign in collaboration with the Royal College of Surgeons of England to make surgery more inclusive for Muslim women and for those from other faith and cultural backgrounds. In terms of the origins of this project, it really goes back to when I was a medical student. I really enjoyed my surgical placements, and however, when I went to theatres, I never saw anyone that looked like me, and therefore never thought that I could never be a surgeon. It wasn't until I started my first job as an FY1 on my first surgical job, my surgical registrars would encourage me to go to theatres and practice my surgical skills. One particular day that I remember very clearly was when, unfortunately, I was told that I couldn't go into the operating theatre because of my hijab, because of my headscarf, without any suitable alternative. And this was because it was perceived, my headscarf was perceived as an infection control issue. I was really disappointed and taken back by this, and I went away and did some research. I found a paper published in the BMJ which essentially highlights the experiences of Muslim female healthcare professionals across the country, and they had experienced similar issues to mine. I also found out about the national guidance from NHS England published in April 2020, which highlights clearly in black and white that the headscarf is permitted in theatres with or without a theatre cap, and an alternative is to be able to wear the orthopaedic hood or a disposable headscarf. Cloth headscarves can be worn, but they must be washed at 60 degrees and only used in theatres. And this also applies to other headwear options, so the turbans, so for those that are from Sikh faith or those from Jewish faith who may wear the kippah. The national guidance also touches on exceptions to the bare below the elbow policy. So for some Muslim women, they feel comfortable with exposing their forearms and prefer to wear a long sleeve. And the guidance says that when clinicians aren't in contact with patients and not delivering patient care, they can wear full-length sleeves or three-quarter length sleeves. When they are in contact with patient care, they should roll their sleeves up above their elbows and ensure that they're not loose or dangling, and effective hand washing should be maintained in between each case. And really this campaign and this project is to raise awareness about the changes in the national guidance, and to encourage hospital trusts to review, to change and update their policy if needed, and also in practice allow for these things to be permitted, such as the headscarf and other headwear in theatres. In terms of the work here at PHU, the EDI team have been really proactive and progressive with their work. It meant that before I started working here, they had already updated their policy, and in practice I am able to wear my headscarf in theatres, which for me it means that I can go to theatres, focus on my operating, focus on patient care, and not have to worry about what's on my head or being asked to leave the theatre. And I'm really grateful to my supervisors and my trainers. My training here has been excellent, and I'm also thankful to everyone at the Trust who has championed, engaged and supported the project. I think other hospital trusts can learn from here as an example, because I truly believe trusts that foster equality and diversity attract the best talent. For staff, it means that it leads to better staff morale and well-being. It leads to healthier relationships with colleagues, and ultimately drives better quality patient care. In terms of representation and what that means for me, representation is important because there's a saying that you can't be what you can't see, and I think it's important to have positive surgical role models. It's important because you need people that look like you from similar backgrounds and positions of leadership, because you have, it supports career satisfaction and career progression. For patient care, I think, we treat and care for patients from all walks of life, and patients need people that that care for them from, from all backgrounds, from people that look like them, that talk like them, that understand them, and can communicate well with them in order to drive patient care. And ultimately, we need to reflect the demographic that we serve. In terms of the next steps for this project, we are really just getting started, and we've got a long way to go. But I think the ultimate goal would be, I really encourage hospital trusts to review their policy and please update your dress code policies if needed, and also consider providing alternative headwear options in theatres to theatre caps. So, disposable headscarves, larger theatre caps for those with protective hairstyles, larger hairstyles, and also to ensure that this is, as well as the policy, that this is actually filtered through in practice on the ground. I think my message to those that are considering, so aspiring female Muslim surgeons, medical students, junior doctors, I think if you're passionate about surgery and you are considering this as a career option, I think go for it, and know that dress code in theatres, headwear in theatres is not a barrier to achieving this.
My name's Fulon, I'm one of the F1 doctors here. I'm just coming up to finishing my first year of being a doctor. I think this project specifically kind of hits a bit close to home for me, especially as someone that wears a scarf as a Muslim woman, especially in surgery, feeling like I can be in theatres wearing my own headscarf without feeling like an outsider, without feeling that there's a problem with me wearing the scarf, just feeling part of a team. We live in a diverse community, people come from all different backgrounds, so it's important that there is some diversity also present within the workforce. It will make them feel like they're better understood. They will feel more included, they feel they can open up probably a bit more if they feel like they're speaking to someone that will have some background understanding of where they come from, what they want, and because different religions, different ethnicities, different beliefs have different boundaries when it comes to healthcare and just having that understanding.
So I'm Sipdeep Pulgil. I'm a shoulder and elbow orthopaedic consultant who also does trauma. I started here in the trust 4 years ago, having worked in Wessex as a registrar before that. So from my point of view, orthopaedically, there aren't many people who look like me around. There's quite a low number across this entire country. And I'm very aware that people aren't aware that they can do this, and I've had trainees change from specialties to come into orthopaedics having met someone who looks like me or having met me, because they're suddenly aware that this is something that they can do. So I feel that showing that there is diversity already out there will then help encourage our best and our brightest into orthopaedics, which I obviously believe is the best surgical specialty that there is. So patients like to see someone who looks like them, who understands their background, who understands what they've gone through, whether that's diversity from a skin colour point of view or diversity from a female point of view, again in orthopaedics. And the feedback I've gotten from patients is that they are really pleased to have someone who does understand different aspects of their life, having been through it themselves. I think this is an excellent project. I think that we are not covering this well enough in surgery, orthopaedics, but all of surgery, and I think it is actually turning people away from doing surgical specialties because they don't think they'll be catered to. I think it's a shame that we're missing out potentially on some of the best surgeons out there who, because of not being able to find head covering, won't want to come to theatre. I really believe that if we can show more support for this project, we can get the best people in surgery to do the best for patients and the best for the service.
My name's Keith Gretz. I'm a consultant transplant and general surgeon. I've been working in Portsmouth for 15 years and I trained generally in the East Midlands. We have to have a broad, diverse group of people that work together, partly because it makes the team healthy, but primarily because we have to reflect the general public. so that we can provide a service that is open and accessible to all. They need to have somebody they can relate to, somebody that looks the same, dresses the same, speaks the same, in the same language, same age, same sex. It doesn't matter. They just have to have somebody they can relate to. Now, for most people, that's not going to matter who they see, but for some, it will be important. I think anything that brings diversity into surgery in particular is extremely useful. Certainly in Portsmouth, we are a very, very male-orientated surgical department. We need more females and basically more people that represent all walks of life, and that includes people that want to wear ethnic dress of whatever type. I think it's a fantastic idea to do this sort of thing. It brings people's views into the open for them to talk about.
Hi, my name's Louise Older. I'm one of the oncoplastic breast consultants. I've been at PHU now since 2021, where I completed a fellowship and I've been a consultant now, coming up to 2 years. I've worked here before as a trainee and it's an excellent trust. I am from a mixed background, so I have both black Ghanaian heritage and white British heritage, and have grown up in the UK and lived here my whole life and trained across the entire country. Representation is important to me because that diversity of thought means that we can expand our collective cognitive mindset, which really allows us to come up with more ideas, new ideas, and do things differently and hopefully better. I think that when we have a diverse workplace and we have representation through the workplace of equal value and equity, that allows us to bring this forward to our patients. Having a diverse representative workplace is fundamental for patients because it ensures that our diverse patient group get similar experiences. They feel that they have the treatment that is similar to an experience that they feel that others can empathise with or may have experienced themselves. And I would hope that means that people get a more equal experience within the healthcare system itself. Furthermore, I think that as we bring diversity of thought as a group of colleagues with different people coming from different backgrounds, having different mindsets, that enables us to expand on our ideas and see how that may be relevant for our different patient groups. And I'd hope that that would really mean that each patient gets the best experience and that we can go forward and continue to improve. For the surgical scarf project, I think that they are doing excellent work. I think allowing that diversity of headwear safely in theatre, as well as accounting for different hairstyles and different hair types, means that everybody can feel that they are equal, that they do not have the experience of feeling othered or any subtleties of microaggression that one may feel when you come into conflict. And this really allows everybody to just work to their absolute best and be their best selves and bring their best selves to their colleagues and their patients.
So my name is Obi Onyekwelu. I'm a consultant plastic and hand surgeon appointed to the Queen Alexandra Hospital, Portsmouth Hospitals University Trust since August 2022. So I'm into my second year. It's very important to have a space where all religions, or people of no religion, all races and all classes feel respected, and there's a space for reconciliation. So I feel that by creating a surgical space where people can express themselves free in their religious attire, or people of no religion, I think that's very important to have such a space. Well, patients are at the center of what we do. They're the reason why we are in this career or profession in the first place. So it's important for patients to feel comfortable, and there is a saying that you have to see it to be it. So patients who are religious or people of no religion coming into theatre and seeing various religions represented will feel comfortable in that setting. So I feel it's very important that we mirror the population that we serve. I've learned a lot by being part of the project. I've learned how that Jewish men wear a kippot and how they're free to express that means of head covering in theatre, and I've learned how the hijab is just as hygienic as the theatre hat, and therefore it is reasonable for Muslim women to express themselves, or Jewish women, or people of that culture, or if you wear a head covering as part of your culture, to express yourself freely in theatre.
I think the Surgical Scarf Project is an amazing campaign or opportunity. I know Azra has started this ages ago. I even wrote an article a couple years ago, and I referenced this campaign when she was just starting off. So she's doing something that I think a lot of us have really wanted to do, and she's doing amazing, and I think the project's amazing, and I think it's going to go really, really far.
My name is Ilaf Osman. I'm one of the general surgery senior house officer working in the hospital here, and I'm originally from Sudan, and I support Surgical Scarf Project.
Hi, my name is Ibrahim. I'm one of the surgical registrars at QA Hospital, and I support the Surgical Scarf Project.
Hi, I'm Jamie. I'm a plastic surgery registrar, and I support the Surgical Scarf Project.
I've learned a lot by being part of the project, and I think it's an amazing initiative. It has challenged and pushed back on some of the dogma that we have participated in as surgeons for a long time, and it's been able to create a space for people to express themselves freely.
Hello, my name's Adam, and I'm the team leader for the Robotic Day Surgery project here at QA Hospital, and I support the Surgical Scarf Project.
Hi, my name is Ibir Victoria Boyle. I'm a theatre nurse practitioner, and I support the Surgical Scarf Project.
Hello, my name is Shaima. I'm one of the theatre nurses, scrub nurse, and I'm supporting the Surgical Scarf Project.
Hi, my name is Lima. I'm a surgical SHO at QA Hospital, and I support the Surgical Scarf Project.
I support the Surgical Scarf campaign across PHU and hopefully the world in bringing equal headwear for all.
Hello, I'm Tasnuva, one of the SHOs working in medicine. I came across the Surgical Scarf Project recently, and I feel like it's a wonderful project that's aimed at bringing equality to theatres. I grew up in Malaysia, and I did my medical college from Bangladesh, having a bit of experience from both countries, where I saw that Muslim surgeons, female surgeons, were able to wear their scarves to the theatres without having any infection control issues raised. So when I started working in the UK, I was quite surprised to find that wearing a scarf to theatres is seen as an infection control issues in certain hospitals. I'm very grateful to be working at Queen Alexandra Hospital, which is a very inclusive trust, and they are championing the Surgical Scarf Project. Surgeons come from all walks of life, and our mission for this project is to make surgery inclusive for everyone, one hospital trust at a time.